Quite as hot tomorrow. The bad news is still hot enough to continue that heat advisory for one more day. Details coming up in just a few minutes.
Thank you, Paul. The heat did not stop people from getting tested for the coronavirus. We saw this line at a walk-up testing site in Mountain View. With more testing, experts say we should expect more cases. But the changing numbers of new COVID cases and trends in the various counties can lead to some confusion. KPI X5's Kenny Choi on the data that health experts are using to get the overall picture. Kenny?
You know, you often hear of spikes and the rate of infection increasing in some counties and decreasing in others. During this pandemic, Governor Gavin Newsom has been very consistent, saying that the first set of numbers that he looks at are hospitalizations and the number of patients in the intensive care unit because of COVID-19. And that's what some leading epidemiologists are emphasizing as well. The constant flow of new numbers and data may be difficult to interpret.
The surveillance data that we look at, how many people were tested, how many tests were positive, what percentage of tests were positive, are imperfect measures of what's happening in the community.
These spikes that we see now are pretty much noise. They're an artifact of who is being tested, how aggressive testing is, day-by-day variation.
So far in California, more than 1.7 million tests have been conducted. Santa Clara County has performed more than 67,000 tests, with about 4% testing positive. In San Francisco County, more than 59,000 tests and 6% overall positive.
It's not waiting to see who comes to you to be tested, but you just say that I will be periodically testing a number of people just to see whether there's any activity in the population.
What we'd like to know is what the rate of infection is, how many new infections there are in the population in a given week or something like that. The problem is we don't know how to measure that very well, except in incredibly difficult and expensive studies.
The latest numbers show in San Francisco there are 53 COVID positive patients in hospitals and 21 in the ICU. In San Mateo, it's 57 and 20. In Marin County, there are 3 hospitalizations.
It's better to guide further decisions based on number of hospitalizations rather than number of new documented cases.
When I look at the data for the Bay Area, there is a consistent downward trend in these important metrics of hospitalizations and deaths.
And bottom line, Rheingold believes that we are now seeing a reflection of less transmission that occurred in the Bay Area 3 to 6 weeks ago. In San Francisco, Kenny Choi, KPI X5.